The original intention of our project was to build a community where people felt they belonged, they felt like they had opportunity to be happy. So we looked at how we could help a community understand factors that would prevent mental health issues and substance use challenges through a resiliency model.
We went through the research, we compiled things that we could pull out of the research that were consistent, where there were a number of factors that clearly contributed to a person being more resilient or having more resilient abilities. So that was our starting point. Then what we did was we looked at things that are obstacles to people being resilient. We made that into a workshop.
What it's really meant to do is create a common language and understanding about different ways that we can cope and deal with stressful times. It's to let us know what we have in our toolbox or what we can put in our toolbox so that when stress and trauma and different times occur in our lives and the obstacles we come across, what we can do to get through them so that we look at things as a challenge, not so much as world-ending.
So the project turned into RLife, which we stood for like our life, also resilient life.
So we're trying to reduce mental health issues, reduce the impact of substance use in families, for individuals, and at the community level.
A big idea, right? One of those global, solve the world's difficulties kinds of ideas. And we, even making the project in the beginning, we said, well, should we limit it to one sector of the community, right? Should we limit it to parents with young children? Should we limit it to kids that are transitioning from middle school to high school? And we said, no, we're just going to do it.
We're going to pack all of our goodies. We've got our wristbands that everyone seems to really enjoy, and they've got all of our some of our core words on them: connected, believe, belong, strong, loved. Primarily, most of our work has been on Vancouver Island and a fair amount of it in the Lower Mainland, but we have extended as far out as the Kootenay regions, and the places we've been have been extensive. We've been into correctional facilities,
RCMP officers, gambling prevention workers.
We've trained a number of school districts to how to use the project and the materials in their school settings in the high school and middle school.
Something that's developed by the parents.
Our main thought was that if we did kind of focus on social service professionals, right, or people that work with people, then it would spread farther.
I would say we've probably trained well over 2,500 people in the last 3 years.
It's not about, my clients have problems, how can I help my clients, right? It's not about that. It's about these are universal ideas, universal skills that apply to everybody.
There is a great connection between resiliency and DARE. They will come and they will train people in your community. Could be senior students to be role models to deliver resiliency. So often we run into kids or young people that have made that one bad choice and they just didn't recognize that they were there, and they live in the moment sometimes and they make those bad choices, and it's like, okay, let's prepare you for that. I want to show you some of these resiliency qualities, go through a few of them. Impulse control, emotional regulation. We see that throughout our lives in policing. When we factor in alcohol or drugs, that does have an effect on emotional regulation. Empathy, to be more empathetic, to be a good citizen, to really communicate well and get away from the risky decisions and from the behaviors like bullying.
How do you cope? What are your survival mechanisms? What do you do to get through and bounce back? Each one of us has these different things that get in the way, these different iceberg beliefs or different challenges that automatically set off triggers for us. I just started practicing different things that I was learning in the workshop, and it was about a year later when I started to realize it had made a big difference in our home, just in our daily life. Everything had turned around. Here, keep it as that one.
Things that worry me are sometimes people that I know. Also in school, so it's kind of stressful when tests come around and homework when I don't get it done. When something stressful happens, I will write it down on a piece of paper and burn it, so it kind of goes away. It makes me feel like I can let go of it and I don't have to think about it anymore.
It's really, really great when I can go to work and share examples of resilience in my own child, when I see her actually making connections to her emotions, reflecting on things that she's done and making sense of what might come next.
So virtually anyone in the world can look at the materials and download everything we have, from PowerPoints to curriculum to posters.
And that's what's so cool about RLife is it's not like, or they've invented a new product, it's always been there. Resiliency's always been there, but it's just about really developing what it's all about and how to factor it into your life.
I really like that you just said, I changed my mind. Because we do this all the time. We go through these workshops and we talk with people and they share their story and we go, we hadn't looked at it that way. A lot of the times at the end of the workshop, someone will come up and tell us how it's personally affected them, what change they're going to make in their life starting that day.
And this is kind of like the last stop on the bus for me, you know, as I'm reaching close to retirement in the next little while. So with this type of work, you know, I keep going back to building strong young people and building people that are resilient. You know, it's just so nice to celebrate that and see the fruits of your labor come through. And at the end of the day, you know, when you leave the profession, you know, you had a bit of an imprint, a bit of an impact on some people's lives.
I hear that a lot with youth too, that it's about influence.
We had a bit of a dream that we could maybe make a bit of a difference in our local community, and the actual change in thinking that we know is happening is really quite beyond our imagination. It's what we hoped for, but maybe we didn't really think could happen.
So we do really like it when you guys share stories, and we appreciate the impact that it has, because that's really how we make a connection with these things.
At the end of the day, you want to be able to go home and think, you know, I've done something that's of value, something that's going to make a difference in the life of an individual or a family or a small part of my community. And I think RLife is really one of those things.